Module 3B. The next thought-challenging skill we will review is the evidence record, which involves determining the hot cognition and then looking at evidence for and against the thought. In this example, the hot cognition or thought is, "I'm a failure as a teacher." The evidence supporting this thought, according to the patient, is, "I got bad evaluations from my students. My students look bored in class. I had negative feedback from my boss. He thinks I lack skills." The evidence not supporting her thought was, "Out of 20 students, I got only one bad evaluation. My class is at the end of the day and the students may be tired. The feedback from my boss was 95% positive, but he said that I should go to a workshop to be able to offer a new program to the students." Keep in mind that the patient may need some help to come up with the more accurate evidence. The evidence gathering form can be downloaded to provide to your patients. In the next video clip, we will see a 50-year-old married white female with a long-standing history of depression with a recent relapse in symptoms. In the previous session, we worked on a plan for the patient to increase pleasurable activities, beginning with getting painting material together with the goal of resuming her hobby. The patient returns to the next session without making any attempts to get the paints together. We explore the barriers to moving in that direction. The patient identifies a "why bother" attitude, which we explore in session and begin to challenge her beliefs with the evidence record. We've been talking about doing things that are more enjoyable, and for homework we had talked about possibly getting your paints together, and you're saying that that was hard for you, that you weren't able to do it. Do you have any sense of what stood in your way?
Well, yeah, I just felt like I'm not a good painter, so why bother? It's just going to be crappy anyway.
So you have some negative thoughts.
Yeah.
Okay. And when you said that to yourself, how did that make you feel?
Well, I just don't have any motivation to do anything then.
Right, right. So you can see that pattern, that when you say those kinds of things to yourself, that I'll just be crappy, why bother, then it affects your motivation.
Yeah.
And then your desire not to want to do it.
Yeah, I just don't feel like doing anything. Yeah.
Yeah. Does that way of talking to yourself affect other activities or a desire to get things started?
Yeah, I mean, I just feel like I don't have any motivation to do anything at all.
Okay, okay. So it's really important for us to take a look at that pattern of the way you speak to yourself and then the level of motivation. If you were going to change the way you were speaking to yourself, what do you think would be an alternative way to talk?
Well, maybe I could say, even if I'm not a really good painter, it would still be fun, so I could just try it.
Do you think that would have an effect on making you more motivated?
Maybe. Yeah.
It's worth a try.
Yeah.
Okay. In the session, we continue to explore the barriers of doing something potentially pleasurable for herself. Two ideas are promoted: that thoughts and beliefs can affect how we feel and behave, and we can challenge beliefs by examining the evidence on the evidence record. So we've been talking about this idea that you're not competent as a painter and that that's an interfering thought and it holds you back from getting started. One of the ideas I have for today is maybe really putting down on paper some of the thoughts you're using as evidence to support that belief. And one of the things we can use is called an evidence record. On one side we can look at evidence that you have to support this idea that you're not competent, and on the other side we can see if we can find some other data, some other evidence to support the idea that maybe you are competent. How does that sound? We want to try doing that?
Yeah.
Okay. So what is the evidence that you've come up with so far that supports this idea that you're not competent as a painter?
Well, my paintings aren't perfect. I make errors.
Okay, so it's not perfect, and I make errors. That
Yeah.
supports that. It means you're incompetent.
Yeah.
Okay. Any other ideas you have that support this idea that you're not competent?
Well, I don't have any formal training, so sometimes I can't figure out how to paint something.
Okay, so if I can't figure out how exactly to paint something because I don't have formal training, I'm clearly incompetent.
Yeah.
So no formal training. All right. Any others?
Well, I had an art teacher in middle school who criticized me and said that my perspective was off.
Okay. So you have one teacher who was critical.
Yeah.
All right. Now, on the other side of things, do you have any evidence or information that may contradict this idea that you're not competent?
Well, some people like my paintings.
Okay. All right.
Sometimes, well, I have this one painting I did that I hung in my living room, and when my friends come over, they usually comment positively about it.
Really? Okay. Okay. Anything else that you can think of for the that contradicts?
Well, I guess not everybody could paint something and make it look even halfway decent.
Mm-hmm. Okay. So the very first thought, if we can, because now you have ideas on both sides, right? We have the supporting the belief, and then we have other information that contradicts the belief.
Right.
So with this first belief that you're saying that since you don't paint perfectly and that you make errors, that clearly you're incompetent as a painter. Okay. That seems very clear to you?
Yeah.
Okay. Is it accurate that if you make errors, that you're completely incompetent and then shouldn't even bother trying? The idea that because you make errors, you might as well never ever bother trying. Does that make sense?
That doesn't sound right
It doesn't
when
sound
you put
right?
it that way.
No? Okay. But when you're not painting, when you refrain from painting and even getting started, it's as though you're buying into that thought, that by making an error, it's a sign that you're completely incompetent. And then it holds you back from getting started, right?
Yes.
So I wonder if it's worth coming up with some alternative way of looking at this. Another way of seeing the situation.
Well, maybe I could say that even if I'm not, the greatest painter in the world, I at least, I enjoy it and it's fun.
Okay. It is helpful to have a firm understanding of how automatic thoughts and underlying core beliefs develop. Core beliefs, or core schemas, are learned through experience with one's environment. They include perceptions about how we see the world, our expectations for interpersonal interactions, and even how we predict our futures. It is helpful to understand core beliefs as a system that helps an individual organize their world. But core beliefs can be faulty and distorted, and will remain that way until skills are developed to identify, challenge, and learn alternative, more adaptive perceptions. Aaron Beck, Judith Beck, and many others have written extensively about core beliefs and their influence on depression and other mental health problems. In Beck's cognitive theory of depression, we can see how the views of self, world, and the future impact the person's mood and behavior, and the underlying core belief or schema, I can't do anything, affects all of his perceptions in multiple contexts. The following are examples of common core beliefs underlying depression. I am helpless. I am inadequate, powerless, incompetent. I am a failure, defective, unlovable, and unworthy. I am bad, bound to be rejected, bound to be alone, and I am different. Left unexamined, core beliefs are difficult to change due to a tendency to dismiss contradictory information and overvalue confirming information. Behavior is often organized to confirm distorted core beliefs. For example, procrastinating and not trying leads to the confirmation that I am a failure and helpless. We will now watch a video clip of a 50-year-old married white female with long-standing depression and a childhood history of living with a physically abusive father. She is the middle child who learned to stay out of the way and keep herself invisible. It is discovered that this patient is refraining from returning to her painting hobby due to at least 2 operating core beliefs, including it is selfish to choose an activity that doesn't benefit others, but that only I enjoy, and it is better to stay invisible. In the following clips, the patient and therapist explore the validity of her beliefs by asking, are old beliefs accurate, and do old beliefs still work for her? So in the last few weeks, we've been really talking a lot about the core beliefs that are interfering in your ability to get started, say doing certain things that are pleasurable. We've been talking a lot about this hobby of yours, painting, that each week we put on our agenda as a homework assignment to get started because you wanted to start painting again. And each week you come back and say, you didn't do it. Yeah. So I wonder if we could maybe look at, we've talked about one core belief that maybe you feel incompetent, and we've tried to examine that. Are there any other beliefs that you feel are sort of barriers to you getting started?
Yeah, I thought of a couple of them. One is that I'm really afraid of being noticed. You know, I'm afraid that if I get noticed, like, I don't know, I just don't like it. I get really anxious.
Okay.
And then another one is that I really believe it's selfish to do something for myself.
Okay. So you think maybe those 2 beliefs are operating that prevent you from getting started with the painting?
Yeah.
Okay. Well, maybe we can take the first one, the belief that somehow you'll be noticed. And in your mind, what's so bad about being noticed? What do you imagine?
It makes me really, really anxious.
Okay, so that's your feeling. It
Yeah.
makes you anxious. What do you think, if you're noticed, what's the consequence?
Well, that I'd get reprimanded, get criticized.
Oh, okay. And has that happened?
Well, it always did when I was growing up.
Okay.
I mean, my dad, when he would drink, he would get really violent or just nasty, and so I got really good at finding ways to get out of the house. I just sort of slip away.
Right, just slip away. And it sounds like actually that was helpful for you when you were a child.
Yeah.
You realized their situation was dangerous, uncomfortable, and you managed to slip away. Are things dangerous now?
Well, I'm not sure.
Yeah, you're not sure.
Not the same way,
Not
I
the
guess.
same way, but you're not sure if there's a need to slip away.
Yeah.
Yeah, okay. Well, that's something maybe that we can try to examine together to see if something that helped you a long time ago is really still working for you now.
Yeah.
We can try to look at the evidence for that belief and really, like we've done before, examine if there's enough to support holding on to that belief in your current life. Does that make sense?
Yeah, I guess so.
Okay. In the same session, we continue to chip away at self-defeating core beliefs.
I can definitely see how I developed maybe the belief that it's really bad or selfish to do something for myself.
Yeah, so that's one of the core beliefs that we've been talking about. Do you have any sense of where that came from?
Well, when I was growing up, we were always told that we were lazy or bad or selfish if we were playing or goofing off.
Mm-hmm.
So we grew up on a farm, and there were always chores to do. So, but even if you did them, nobody was going to come and tell you that you did a good job or praise you. I mean, it was like you shouldn't expect to be recognized for what you'd done.
That's right.
So, I mean, even if I did something like got good grades at school or I made an achievement,
Mm-hmm.
if I brought that home, the message was that it was wrong, that it was selfish to bring that to anybody's attention.
Okay, so you learned that got that message really, really strongly in your mind, that
Yeah.
core belief.
Yeah.
And that it's really selfish to put yourself out there, to be noticed, to do anything good for yourself.
Yeah.
Yeah. So, if that were to ever change, what would you imagine that would need to happen?
Well, I don't know. I guess I could just keep trying it and see what happens. I don't know. I guess I just have to believe that it's okay to do something I enjoy.
Right, right. So, although you learned that core belief really strongly, and it made sense in the past because that was what you were taught, for right now, the only way to really chip away at a core belief that's been so ingrained for so long is to try to do something different and see what happens.
Yeah.
Right. And if you were to try the painting, how do you imagine you would feel initially?
I think I'd feel anxious. Yeah.
Yeah, you'd feel more anxious because it's not something you're used to. But if you did it repeatedly, what do you think would eventually happen?
Well, I mean, maybe I'd realize that nobody's actually noticing me while I'm painting. And maybe if my husband did notice me, he might be happy for me.
Right. So there's always that possibility. Do you think it's worth experimenting with?
Yeah. Yeah.
Okay. In this session, we continue exploring risks and benefits to holding on to the old core belief, and if it is better to stay invisible.
So, I think my belief that I'd rather stay invisible is also connected to my reluctance to paint. I think that when I paint, it represents me, and so I feel exposed.
Oh. And how does feeling exposed make you feel?
I feel vulnerable.
Vulnerable. Vulnerable to?
Well, vulnerable to danger, to being hurt.
Okay. And dangerous to being hurt, and that relates to someone knowing you via your paintings.
Well, yeah, because I feel vulnerable to criticism.
Okay. So that could happen,
Yeah.
right? Is there any downside to playing it really safe?
Well, I feel like I don't have any fun because I don't get to do what I enjoy, and I also feel like I'm missing out because people don't get to know me.
Now, do these things seem important to you?
Well, I know I want to do things I enjoy. People getting to know me, I'm not so sure.
Okay. So, but what if truly that that this belief of yours that painting and then exposing yourself to others and letting them know you is not really as dangerous as you might think?
That would be good.
That would be good to figure that out.
Yeah, if I knew that was true.
Yeah. And how do you think you could go about figuring that out?
I guess I'd have to try it and see what happens.
Right. Does that make sense?
Yeah. Yeah. It's scary.
Scary. The following 2 slides are handouts given to patients as an introduction to understanding the challenging and disconfirmation process of faulty core beliefs. It is helpful to highlight for the patient how core beliefs color our perceptions. If core beliefs are overly negative, then it is helpful to learn how to identify and challenge them. Some strategies to challenge core beliefs include: find the belief by looking for themes, patterns, and key words. Make a choice to willingly challenge and change the belief. Question the belief by asking, where is my evidence to support this belief? By clarifying the belief via questioning, examining, reflecting, taking a more objective stance will help diminish the power of the distortion. Using the thought record is a great tool to help with this process. In the next video clip, we will see a 47-year-old married white male with a long history of depression and obsessive-compulsive disorder. He comes to this session feeling that he is sliding further into depression. Our case formulation suggests that the patient believes that he is a failure, weak, and incapable of having an impact on the course of his life. The effect of this core belief is that he is conflicted about putting effort into tasks versus taking the easier road of non-action. With some exploration and understanding, the patient is more aware of his pattern and possibly less apt to buy into his long-standing core beliefs, and therefore less likely to sabotage himself. So we've been talking about how it's been really difficult for you to get started on a lot of tasks lately. Do you have any sense of what's standing in the way? What might be interfering?
Well, I just don't want to do anything.
Do you have any sense of why?
Well, I just feel like, what's the point? You know, like nothing's going to turn out anyway.
Okay. All right. So what's the point? Nothing's going to turn out anyway. There's a lot of negative expectations.
Yeah.
Okay. And so when you have those kinds of ways of thinking, how does that affect your behavior? What are you doing with your time?
Well, I've been like calling in sick and staying home a lot.
So pretty avoidant.
Yeah.
Okay. And is that helpful to you? Does that?
It is in the moment. Like, I don't have to deal with the anxiety.
Okay. Okay. So it helps temporarily. It's not really helping to get the tasks done, though,
No,
that you
not
say
at
you
all.
need to get done.
Yeah.
So if you were to respond differently to your thoughts, what else could you potentially be saying?
Well, I know what I'm supposed to do, you know. Supposed to confront those thought patterns and beliefs and just change how I think about the situation.
Okay. You can be like examining your thoughts and seeing if there's any evidence
Yeah.
for those thoughts. Yeah, we have talked about that.
A lot.
Yeah.
But,
Or not. You could just stay in bed.
yeah.
That would be an alternative. Right?
Yeah.
Doesn't seem like you want to do that.
Well, I can't. I mean, I can't do that. That's the problem.
Okay, so it's a tough decision. Staying in bed, avoiding, feeling a little bit better temporarily, or really doing some good work and challenging those thoughts. And maybe that would affect how motivated you feel to do the work.
Yeah, I think it would.
Worth a try, and maybe we can try to work on that together.
Sure.
Okay. Later in the same session, the patient and I discuss how identifying the way his core beliefs are operating can allow him to take a step back and make a choice about how he will perceive himself. We also examine how he can choose to take responsibility for his own change process. So, did you have anything else you want to talk about today?
Yeah. I was wondering if we could maybe up our sessions to twice per week.
Oh, any specific reasons why?
Well, I mean, I feel better when I come out of the sessions because of the work we do, and I just thought that if we did 2 per week, then I would be able to feel better more.
Okay, well, that kind of makes sense, but what I'm wondering is, how do you end up feeling when you actually apply the skills that we've used, say, when you leave our sessions? How does that usually make you feel?
Well, when I use them, I feel better.
Yeah.
Yeah.
Yeah, so you've learned quite a few skills.
I have, yeah.
Yeah, yeah. You've learned how to be more aware of your emotions, all the thought challenging skills we've worked on. And I've seen you come back in here every week and share with me all the things that you've done to really work on this stuff.
Yeah, I guess I have skills, huh?
Yeah. I think it's worthwhile paying attention to really how many changes you've made.
Oh, yeah, I guess I have.
Yeah. When we are helping patients identify their operating core beliefs, we encourage them to look for recurring themes in their automatic thoughts. It may be obvious what a patient's core beliefs are, but sometimes it is not clear. When it is not so clear, then we can use a downward arrow digging or exploring technique. When we use the downward arrow technique, we are essentially trying to discover what the basic underlying belief is that guides the patient's automatic thoughts. In this example, the trigger situation is the patient's boss saying, "I see you have free time on your hands," and the patient becoming extremely anxious. The patient's automatic thought is, "Uh-oh, I'm in trouble. She thinks I'm slacking off." To elicit a deeper meaning of that automatic thought, you can ask the patient, "What would that mean if on this occasion she thought you were slacking off? And why would that be so bad?" The patient replies, "It means that I'm a bad employee." The therapist can ask, "What does it mean to you if she sees you as a bad employee?" The patient responds with, "It means that I'm incompetent, stupid, and inept." This may be the patient's core belief, which would explain why her boss's comment elicits such extreme anxiety. The therapist will also challenge each level of the patient's automatic thoughts and core beliefs by asking, "What evidence do you have that what you think is accurate?" Some additional dysfunctional core beliefs can include, "I must be perfect to be accepted or liked. Without a partner, I am nothing. No matter what I do, I'll never succeed. I must always be in control. If people really knew me, they wouldn't like me. To be accepted, I must always please others. People are untrustworthy, and the world is a dangerous place." In this session, a 50-year-old married white female with a long history of depression is struggling to identify what core beliefs may block her from moving forward. Within the session, it becomes clear that the patient could benefit from learning to become more aware of what automatic thoughts and core beliefs are operating.
I don't know why, but I really don't want to go out for lunch with my friends today. I mean, I made the plan, but I feel like I really just don't feel like doing it.
Do you have any ideas about what might be operating? What thoughts are affecting whether you want to go or not?
I'm just feeling really down on myself right now.
So what is, you're not feeling yourself, and what does that mean?
Yeah.
If you're not feeling yourself,
I mean,
what's...
not bubbly, not fun.
Okay. And why do you think that's affecting your desire to go or not to go? If you're not bubbly or fun,
Oh, it
then
wouldn't
what?
be any fun to be with. It wouldn't be good company.
Okay. And if you're not good company, then...
Then I'd just be boring.
Okay. And what's your thought about if you're boring and you're not fun, then what effect would that have on your lunch plan?
My friends wouldn't really want me to be around.
That's what you're thinking, that your friends would want you around if you're not your usual bubbly self?
Yeah, I mean, that's what I'm thinking. I know it doesn't really seem reasonable, though.
Do you have any evidence, real concrete evidence, that if that were to happen, that your friends would not want you to even come to lunch? Wouldn't
No.
want to be there, would reject you?
No.
You don't have any evidence of that?
No.
Okay. So that's really the tricky part, isn't it? That you have these powerful thoughts and beliefs, and they're affecting whether or not you want to go for lunch. And yet when I ask you whether you have actual evidence that that would be the case, you don't really have any. And so the tricky part is to kind of go forward in spite of those worried thoughts that you have. Because they're just worried thoughts at this point. You don't have any evidence to support them.
Yeah, that's true.
Right, so what do you think would be the best option for you? Should you avoid the lunch date, or should you try and experiment and see what happens?
Yeah, I mean, I think, yeah, it makes sense. I should go and try it and just, see what happens.
Yeah. Role-playing can also be a powerful thought-challenging technique. The therapist can be the voice of distortion, and the patient can play the role of voice of reason. Or the patient can be both voices, switching back and forth. It can also be helpful to ask the patient to imagine talking to a friend who has identical core beliefs and see how the patient, as the objective friend giving advice, responds in that role. It is important to use your case formulation and what you know about the patient's distorted core beliefs to guide this exercise. In the next video clip, we will see a 45-year-old married white male with a history of obsessive-compulsive disorder and depression describing recent financial problems. He presents to the session with increased depression, anhedonia, and hopelessness. In this session, I try and help him connect with his more competent, logical, strong side.
So moving ahead and doing the things I need to do, it's just too hard. I can't do it.
Okay, I think I have an exercise that might be useful for us if we could do that. Would that be all right? We're going to do a little role play exercise.
Okay.
So in this exercise, what I'd like us to do is I'm going to take on the role of your defeated, hopeless side.
Okay.
And what I'd like you to do is take the role of your more competent, wiser side, if we can try that.
Okay.
Okay, so I'm going to start. So there's nothing I can do. I'm totally defeated. I have financial concerns, relationship concerns. I'm a complete loser. Nothing's ever going to get better. I'm washed up.
no, no, you're not washed up. Things have happened for a reason. You're gonna,
No, you don't understand. My father told me my whole life that I was a loser and I couldn't do anything, and nothing's ever worked out for me, and there's no point even trying.
you have to try. You have tools you can use. You don't have to listen to your father. You can just go forward. Take one step at a time. You don't need to do it all at once. Just do one step at a time.
What was that like for you, to take on that role?
That was weird.
Weird.
That
Yeah.
felt really strange,
Really
but
strange.
good.
Yeah.
Kind of.
See? It's in you.
Yeah,
That's part of you.
that is part of me, huh?
Maybe we can do this a little bit more.
Yeah. As
Okay.
long as you take on all the negative stuff, I think it'll work out good.
Yeah, but you did a good job.
Oh, thanks.
Yeah,
Yeah, I liked that.
good. It can be very helpful for patients to learn how to balance their maladaptive schemas with core healthy schemas or core beliefs. For example, no matter what happens, I can manage. Some people will like me and some won't. I deserve to be respected. I can learn from my mistakes. Some people are kind and trustworthy. I am capable. It's okay not to be perfect.